My name is Dr. Priya Kalia. I'm the Managing Director of SciTribe, a boutique communications consultancy that focuses on profile raising, writing and research for the science and technology sectors. On the 6th of July 2023, One Nucleus, the not-for-profit UK life science and healthcare membership organization, hosted On Helix, a one-day conference addressing key bioinnovation trends in life sciences research and technology and their translation. And at this meeting, I moderated a panel called New Horizons in Genetic Screening. This panel hosted experts from across the public and private organizations such as Genomics England, NIHR Bioresource, the Earlham Institute, BC Platforms, and Enhanced 3D Genomics. It was fantastic as an all-woman panel to see such expertise being shared across the board. We discussed genetic screening across the life course, from birth through to old age, and the latest technologies and how they could be realistically translated to the clinic to benefit patients. We also looked at real-world data, data access, ethics, and sharing. And here are some of the highlights of that panel. The first point was learning more about genetic screening at the start of life. We learned about Genomics England's newborn screening program, which aims to sequence the genomes of 100,000 newborns in the UK for rare genetic diseases. The intention is to launch the study by the end of this year. In terms of clinical study design, this was an interesting area discussed extensively in the panel. It was useful to hear feedback and concerns about the ethics of clinical studies. Kate Harvey from Genomics England talked about the principles of co-design, deliberative methods, and how to use an ethics-based approach to study design. This includes involving patients themselves in the design of clinical studies. Another area that was looked at in terms of data access is privacy and data protection. The potential to use federated data access to address scalability challenges was one topic mentioned by BC Platforms' Kerry Thompson. A federated data platform means that different data custodians are able to share data and access it from a single federated database, while the data itself does not move. This can ensure a safer data sharing or data access situation because the data never leaves its original environment, and so is enabling for genetic screening studies. Another topic that was debated in the panel was translating genetic data into clinical practice and how this is still an apparent need. Biobanks hosting rich patient data are a powerful tool, as Edyta from the Earlham Institute mentioned. The role of the patient community in gathering essential data to determine which individuals will benefit from which therapies is also an important area of focus. Clinical training for new technologies is another essential area with challenges to overcome. Dialogue exchanges between researchers and clinicians here can help redefine research hypotheses by focusing on specific patient types and diseases of interest, as mentioned by Edyta from the Earlham Institute. This collaborative approach can help save time and resource. Public consultation was touched upon by Kate Harvey from Genomics England. She described the results of a public consultation that Genomics England ran for their use of whole genomic sequencing in newborn screening. The results of such screening could impact the entire lifetime of an individual, and hence including the public in that deliberation about how to go forth with the study is extremely important, as is creating an accessible forum where the science and the study is communicated in simple and easy to understand terms to better understand the feelings that people have on this subject. The last topic was about data custodians and data transparency. Who should be the guardians and custodians of data? And how do we educate them about how data should be reused, how it should be stored, and how it should be accessed? It's not only about generating data, but about proper storage, and safe and proper access. You need trust between patients, parents, sample donors, scientists, clinicians, and everyone involved in such a study. If individuals hold their own genetic data, they might be aware that they're carrying a certain gene that's associated with a particular disease. Another challenge is preventing the misuse of such data to use it against an individual. For example, deciding on insurance premiums or whether an individual should be insured. So we got into a little bit more of a contentious area with this last point. I think one of the big questions that people came to me afterwards with was, who should be the data custodian? And I think a lot of people felt ultimately that the individual whose data it is should be the custodian of their own data. And the implications of this, I think, are manifold and long-term. We are moving towards a future where genetic screening will be playing more and more of a prominent role in our clinical care. The translation needs to be smoother. We want to apply and use genetic screening across the life course to ultimately improve patients' and everyone's health and well-being. And to do this, ethics, patient and public involvement and engagement is critical. Thank you for watching. I hope this was a useful recap of what we discussed at On Helix. And we look forward to seeing you at next year's meeting, as well as Genesis coming up in December.